Hello, my name is John Wiebe. I'm a resident of London, and I have the privilege of also saying that I was born on Pelee Island. My wife and I prefer to vacation within Ontario, and Pelee in turn has become our preferred spot by far. As a result, we have spent and continue to spend virtually every weekend here from April through to October. I am particularly concerned about the medical service cuts that are being put forward. On a personal level, I am now at an age where I can expect to require more medical services. What I will need and when remains to be known, but it will happen. At the same time, my wife and I want to share what we have here with friends and family. Will the service changes lead these people to question whether they should come? Will it lead us to be more careful in terms of who we invite and for how long we choose to ask them to come? Medical emergencies happen anytime, day or night. Quick response is critical. Given the limitations of the ferry and weather, a quick response to a medical crisis is really out of the question. Medically fragile individuals will be well advised not to come here. A key principle that was identified to define who we are collectively as Canadians was to aspire for good governance as a country. The withdrawal of services that we see happening here is a blatant violation of that which defines who we are as a people and a nation, particularly for the citizens of Pelee and the people who visit here. As a province, the Premier has proudly promoted how we care for all of our citizens. I really question that view now. Almost daily, Minister Matthews is making announcements of new health funding allocations. She's making assurances that what's being made available is not going to be undermined, that what we have will not be eroded. Pelee is not seeking expansion, only what it's had. Its services are being eroded. I guess, therefore, it depends on where you live as to whether you are in or out. At this point in time, access to health care exists for those who live north of Kingsville and Leamington Docks. Should the services not be reinstated, people like my wife and I will need to revisit whether Pelee should continue to be our preferred destination, as it will no longer possibly be a safer place for us and for our family. To me, this service cut is like saying to certain people within the province of Ontario, you are no longer eligible for EI, OAS, or CPP, for example. It just doesn't make sense. As I noted, I was born on Pelee, and I'd like to add that when I was born, the delivery was managed by a Dr. Reese, a doctor who is a resident of Pelee Island. Premier McGuinty and Minister Matthews, please reinstate services. The life on Pelee and the livelihood of its people are at stake.